Okay, hi everybody. Thank you for joining me on another episode of Get Into It with Gila. I'm Gila Glassberg, registered dietitian and certified intuitive eating counselor. And today I have the privilege of interviewing Shifra Schnair. Hi, Shifra.
Hi, Gila.
How are you?
Okay, I'm good. This is so nice. Thank you so much for doing this and bringing these
Sure.
messages out.
Yes, I'm so happy that I'm able to do this, and I'm so happy that there are other professionals out there doing the same thing. So thank you. So could you tell the listeners a little bit about yourself? Where do you live, and what do you do?
Sure. Okay. Hi, everybody. So my name is Shifra Schnair. I'm a psychotherapist in Cleveland, Ohio. Actually relocated here from New York about 3 years ago. So I have a private practice now in Cleveland, and I do a lot of work with trauma, with depression and anxiety, and how those are presenting struggles for people. And we intertwined in a lot of that, of course, is work with body image and disordered eating and struggles with food. And so all of those issues really intertwine together. And so that
That makes sense. Amazing. So did you always know that this is what you wanted to do as a career?
So it's interesting, actually. So I'm trained as a marriage and family therapist. So, that's officially an MFT. And when people hear that, they say, oh, so you do marriage therapy. And it was how I was trained. And the perspective of training from that perspective is a little bit different than the general perspective. But I actually really moved away from doing mostly couples work. And I really now do mostly individual work. So I always knew that I wanted to go into the counseling profession, but my focus has shifted quite a bit from when I initially started. And I always knew also that, the body image piece I always knew it was always part of every struggle that comes up for people. So that was always there in the background.
That's so interesting. So why did you want to be a counselor, if you don't mind me asking? Like what drew you to that profession?
Sure. It's funny. It's funny, actually. I remember in my 8th grade yearbook, when they say, like, what are you going to be when you grow up? Mine said I was going to be a psychologist. So somehow always at that point, it was something. I don't know. I really just feel, like they always say, of course, we want to, look at parts of ourselves, understand better parts of ourselves. But there was always something that drew me to this intense connection to people and their struggles and their pain. And it's just such a fulfilling and, humbling and awe-inspiring field. And
Definitely. So you think that you were one of those kids that was always like giving people advice, or the listener, like that type?
So somewhat. I wasn't like a super outgoing kid, but I guess I always had this like intensity. Like I'm an empath, and I always had this intensity, and I guess maybe people picked up on that.
Totally.
Yeah.
I can relate to that also. That, like, people always say like, oh, you are sort of like a therapist, like you're a food therapist. And it's like so interesting. But actually I heard that like that's like it's like an introvert profession, because like we like that one-on-one intensity. And it's like I actually know someone who's super extroverted, and she became a social worker, and she was working in the field, and she told me like after like 1 or 2 years, she's like, it's so boring, like it's so intense, and she's such an extrovert. Like I'm like, oh, because I thought she would be so like good at it because she's so like great with people, but like she gets that energy from like the crowd, and I'm like the opposite. Like I love that like intensity.
Yes, I'm the same as you. Definitely. I'm
Yeah.
definitely an introvert.
Yeah.
And somehow there's really something in that draw about working with somebody just one-on-one and being in that intense, back and forth and understanding their story and hearing their pain.
Yeah. Yeah. Not to make this about me at all, but it just also, I see that a lot with like my friends or like clients. Like you want to, like, that's your personality. Like you want to hear the whole story. Like when I'm asking someone about their job, I'm like, tell me your day to day. I want to understand, like, because it's like that. I think it's like an introvert thing.
Yeah.
Okay. So you were doing marriage counseling, and then you shifted to more like, could I say like intuitive eating, health at every size? Is that like, did you come across that in your private life? Like, how did that
Yeah.
happen?
So I mean, that's such a amazing question, because like everything's intertwined. As a therapist, what I do as a therapist is so much about who I am as a person. I mean, there always is, like we talk about being a therapist, we talk about bringing in the self of the therapist. So it really is about who I am as a person. And so I don't think that my intuitive eating journey actually started because of the work that I do. But they definitely at this point do go hand in hand. I think it started at some point in my life where I was kind of just like, dieting just doesn't make sense, whether I can't keep to one, and it just like, I can't imagine never eating a certain food again in my life. Like that just didn't make sense to me.
Mm-hmm.
And when I heard about intuitive eating, it just really clicked. And when it clicked, I just knew that that's what makes sense for me. And that's the path that I want to go on. And since then, it's really kind of been part of the way that I work as a therapist, and, you know, the way that I live my life and the way that I see clients and their struggles
Mm-hmm.
in their body and food.
Definitely. So
Yeah.
do you mind sharing a little bit about like your personal journey? Like, did you grow up with like negative body image? Were you always on a diet? Like, was
Sure.
that
So
part of your life?
yeah, definitely. I mean, it was always like, I'm trying to keep my body to a certain size. Um, I've definitely been through experiences of Weight Watchers, never really been able to keep to them, for a long time,
Mm-hmm.
keep to it for a long time. But yeah, it's just definitely been that pull for me of my body should look a certain size. And it was only much later in my life, maybe, where I had this realization of like, I need to just stop chasing something that's not going to happen. And it was a long journey really to learn about intuitive eating. I mean, I'm still on a journey of intuitive eating, and yeah.
So how did you stumble upon it?
Yeah, so that's, it's interesting. I really don't know how I stumbled upon it. I'm really trying to remember. Like, I remember a specific encounter with somebody where we were talking about it, but I feel like that was after I had heard about it already. And it's kind of a mystery to me about how I found it. Maybe it kind of just fell into my lap somehow.
Right.
But once I started to learn about it and to read about it, it was like, this is the way I want to live my life in terms of my relationship with food and my body.
Yeah, totally. And then did you have the same thing with Health at Every Size, or was that also like a little bit harder for you to
Yeah.
buy
So
into, let's say?
yeah, sure. So Health at Every Size actually came quite a few years after intuitive eating. It was like, okay, here's intuitive eating. Here's how I'm going to eat. But like, I'm still not so happy with the way my body looks,
Right.
and it took a long time. And I think it was actually as a professional that I came upon and learning about Health at Every Size. And it was not a hard thing for me to accept at all, like in terms of saying these concepts make sense. It's a lot harder to say, okay, I'm happy with my body the way it is now, because of all the external messages. But I think that Health at Every Size is just such a fundamental piece of even just, connecting to ourselves. And so much of the work that I do in trauma work is about grounding and coming back into the moment. And that's so much of the work also about intuitive eating and being okay with our bodies. So Health at Every Size is really kind of a message that I just intertwine in this whole, the whole living intuitive life.
Yes. I'm so happy that you just said that, because I was just going to like try to transition into like the professional aspect of what you do. And like, I almost had like a little bit of a visceral reaction to when you said like trauma is about grounding, and how it's so like Health at Every Size and intuitive eating just clicks right onto that, because it's like so much of what I do with clients, or what I see with clients, is like the trauma around their body. And it could be something like being put on a diet at age 5,
Sure.
So
Yeah.
it's like traumatic, really.
Yeah, absolutely. And I think it's really, I think people get really afraid when they hear the word trauma, because trauma sounds like this big scary monster, and it's really helpful if we could just like understand that trauma really is anything that we go through that's like overwhelming, that we don't have the capacity to respond to. A child who's put on a diet and then is hungry, their body and their brain is having reactions to that, and so that's a trauma reaction. And when they grow up living with that, that's more ongoing trauma. And so trauma, really, we all live with aspects of trauma. And very, very often, and when we go through specifically body related traumas, but any trauma, there's that piece of not being in touch with ourselves and our bodies. And so much of that is related to this food body struggle. Yeah.
And something that I hear a lot from clients, and I could relate to also, is that like exactly what you just said, like intuitive eating is so great and it's so liberating, and the tools help you in life, not just eat intuitively, but live intuitively. But then there's that piece like, but I still wish my body was different.
Yes.
And I think that's probably the hardest part.
Yes, absolutely. And that's a struggle, here I am in my journey, and that's a struggle that I struggle with. There are days that are easier. There are days that are harder. There are messages that come out. I mean, I think a lot of there's a lot more messages now, even in the past couple of years, about, the body positivity and Health at Every Size and all of that. They are getting stronger, but there still are a lot of messages of, bodies should look a certain way. So it's very, very, very difficult. We're fighting against a lot, personally and professionally.
Right. I say that to clients all the time. Like, you have to remember like how many years you've subscribed to diet culture versus how many maybe months you've been learning about intuitive eating, and like it takes a long time to rewrite that script, and like and then to be bombarded, if you're on Instagram, if you're living in this world and you see advertisements, then it's just really hard to remind yourself that like everybody is different, everybody has things about their body that they like or don't like, and everybody has things about their life that they like and don't like, and that's just like, we don't have to like body image with Brie. I don't know if you follow her on Instagram, but she says like that we scapegoat our body, like that's her, I think she started that phrase, like it's true. Like I think I see that also a lot with like people who have experienced any sort of trauma in their body, that like their bodies, it's like the body is like the source of all problems. And that's super painful because you interact with your body on so many levels.
Yeah, definitely. And it's so interesting that you say that, Gila, also because sometimes people think about their journey towards eating as like, here's a struggle in and of itself. And there really is always so much of the push and pull of the other mental health pieces that are involved and the traumas that are involved. And it's like, well, I can fix my traumas, but I can still diet. And it's interesting because as a therapist, I really don't talk about dieting. Like that's not my role. I don't have any food or dieting conversations. But there always is that sense within me of like, are we listening to our bodies in this moment? Are you listening to your body? Are you grounded with your body? And that always is antithetical to dieting. So it's really always is there. Yeah.
Yeah, that's so interesting because I like to I think like, just for listeners to know this, I think that a lot of times people think like within my sessions that I don't even talk about food because I'm talking about the other stuff. But like you like basically like what I try to start with is like the hunger fullness scale, and explaining that we all feel hunger and fullness in a different way, and that we can feel it in different parts of our body, and that we can feel it at a different intensity. And just as a side note, like I know I say that I'm a highly sensitive person, and the person who wrote the book, she says that like you're more sensitive to hunger. And it's like really true. Like my husband knows, like if Gila's hungry, like we can't go anywhere. Like I'm not the type of person that ever skips meals. Like I need to eat every 2 to 3 hours, And I definitely didn't when I was like stuck in diet culture, because I was like, I shouldn't be hungry now, or like that's crazy. Like I had carbs already today, or whatever my food rules were. But like when I explain this to clients, I tell them like, let's say I'm talking about it for them or their child. I'm saying like, think about it. Like we tell our kids like, oh, you can't possibly be hungry now, or like you're probably full by now. And like, you're not just turning off their hunger fullness signals, you're turning off their intuitive signals. Like if they feel unsafe around somebody, if they know that something doesn't feel right, their gut, like we are literally telling them, ignore that noise and ignore that feeling. It's like, it really is detrimental.
Yeah, absolutely. There's so much of that body awareness that we lose when we talk about dieting as adults, and especially when we're encouraging that in children. It's really it says, hey, let's turn off, like you said, that sensor to have any awareness of myself and be able to express my physical needs and my emotional needs.
Right.
Yeah.
Can you speak a little bit about the actual like tools that you use in terms of like body awareness or grounding, that maybe obviously this isn't in place of therapy at all, but just for somebody to maybe get a sense or a feel of like what tools that you use when these things come up?
Yeah, absolutely. So again, just to put this out there, like I definitely don't, am not a nutritionist, and I have no training in the food background. And so I really don't talk anything about dieting or all of that. But what I do is work to get a better body awareness, just a sense of like what is going on in my body right now. And so sometimes that may be food related, and very often that's not food related, and that's but it's just bringing out that awareness. So there are so many ways. There's the typical 5 4 3 2 1, just noticing what's around me and just having a sense of like, oh, I have senses that are just noticing the world. So that's noticing 5 things you can see, 4 things you can hear, 3 things you can feel, 2 things you can smell, 1 thing you can taste, or any of those things. So that's a 5 4 3 2 1, and that just helps us connect to the fact that like we do have a body, because also life is so busy and there's so much hustle bustle, and sometimes people come to therapy with so much to share, and sometimes it's so hard to kind of make that disconnect and say, okay, now I'm going to a place where maybe we're going to slow down a little bit and just notice that there is a body within all of this. So that's a really good one. Sometimes we even just like, just put on hand cream and just notice the smell and notice how that feels as it goes on, or even just touching something that feels wet or holding onto a piece of ice. Sometimes that even works for more intense grounding. So there's all these ways of just noticing, of course, breathing strategies. I mean, there's so many things of just bringing back that awareness to the body. And that, again, is really just intertwined with that, I can create body awareness, and then I can know the other aspects of my body. And very often I will refer people out to, of course, if we could find a good listing of somebody who's, intuitive eating based and subscribes to Health at Every Size, but I will very often refer people out to that other aspect as well of, for, food and nutrition. Yeah.
Yeah. I love that 5, 4, 3, 2, and I actually never heard of it. Really interesting. Yeah. Also, like I know one of my supervisors has said, like, when things come up that are like, obviously there's an overlap between the nutrition and the psychology part, because that's just the way it is. But there are certain things that I'm not equipped to deal with. And I'll say, like, take a sticky note and bring that to your therapist. But I do know that that's like a tricky overlap, but like, definitely, like you said, like, you don't necessarily speak about the food and the nutrition, but like, it obviously comes up because, like, you started out by like introducing yourself. You were just saying, like, it's all related, like the anxiety, the depression, that's felt in your body, that's like, you can't separate that at all.
Absolutely. Absolutely. And trauma, the big piece about trauma is we say trauma is a memory that's held in our bodies. And so there is no separation between anything, and food is body related. I mean, that's what our body is for. And so there's no separation as much as we try to separate it. So yeah, it definitely comes back up, and I will say also, it's a very, very, very difficult journey to say, I'm not, dieting anymore. And very often it's not a place where, people want to go or, which is fine. I mean, body awareness can happen, and it's just, it just will bring up those other aspects as well. And then a person will say, how do I want to target this now that these pieces are coming out?
Yeah. Also, like, dieting represents so many things for so many different people, but like, there are those people who, like, were put on a diet at a very young age, and like their autonomy was threatened, and they still feel that threat in adulthood. And then there are people who utilize dieting because everything else was so out of control. So, like, it's not even like necessarily a weight thing. It's just like, almost like, a crutch.
Yeah. Definitely. And again, there are so many negative messages. I mean, I would say, especially for, for girls who are dating, but at any stage of life, there are so many negative messages. I mean, women who have babies, and then it's like, my body has to, I mean, there's just messages are everywhere, and it's very, very difficult. And sometimes people who are, especially like in a place of intense trauma or really struggling, are not necessarily ready to say, I'm breaking away at those messages right now.
Could you speak a little bit more about what happens in our body when we experience trauma?
Yeah. So what happens? So trauma has kind of like the two aspects. There's what happens in our brain, right, and then there's what goes on in our body. And so when we go through trauma is an experience that we hold onto in our body. So our brain doesn't process through the experience of trauma as it would process through another experience, right? So something that's too overwhelming. And there's a lot of neuroscientific components to this, but in terms of the body aspects of it, it's like it gets stuck in places. And so sometimes with clients, we'll say, okay, go through, or they'll be sitting with a trauma memory, and it's like, where is that sitting right now in your body? How can we notice that? What happens? How does it slowly shift? And so there really are places, there's even some people who talk about the connection between chronic pain and trauma, because trauma really sits in certain, and depending on the experiences, it will be in different places for different people, but it really has the physical sensations that we associate. And we don't think about it. I mean, we go through life like, without even like having this awareness. But when we do bring this awareness, we really notice where that trauma comes up. And, sometimes people will, as we get deeper into processing the trauma, it's about like, what shape does it take? What weight does it? So many different pieces of just understanding what that feeling means, but it's a very physical feeling in the body.
I actually have had this with clients that, like, when we do the hunger fullness scale, like I was saying before, like, understanding like how hungry you are, how full you have become, So I'll explain that like different people feel the sensation of hunger in different parts of their body, right? Like some people feel it in their stomach and some people feel it in their head, etc. But actually what I do notice is that a lot of people will say like that's like wherever they experience like hunger and fullness the strongest is where they experience their emotions also the strongest, which is really interesting because they get confused between, because they've been whatever dieting or whatever restricting and completely turning off those cues. It's confusing. Am I hungry full or am I emotional? It's like really confusing.
Wow, that's so fascinating. I didn't even
Yeah.
know that there was that connect. Like I didn't even know there was different ways to feel hungry. So that's really fascinating too.
Yeah, it is. I know. And I also like try really hard to stay in my lane. And I read a lot about like trauma. And I happen to think that there is like maybe one day, God willing, like I'll take a trauma training for dietitians because it's like, it's so interesting. Like Evelyn Tribole, one of the authors of Intuitive Eating, I remember taking her training and she said, she was going over like the timeline, someone's weight history. So like they weighed this, for some people, this is triggering. For this person, she felt it was appropriate. So at this age, I weighed this, and this age, I weighed this, and whatever. And they went through the weight history, and there was a clear like 50-pound weight gain in 1 year. So she asked her, did anything significant happen that year? And I think she said she got into like a really bad car accident or something. And it's like, and I see that too with clients that like, and that's not just exclusive to intuitive eating, because when I worked in a nursing home for 5 years, and my job, if anyone's listening, the job of a dietitian in a nursing home is to be obsessive about weight, but not so much about weight gain as more about weight loss. If somebody's like very ill and they're losing weight, that's usually an indicator that something's really wrong. Like either their appetite's really poor and we have to do something about that appetite stimulant, sometimes feeding tube at some point. Sometimes they just don't like the food. That's more like of a practical thing. But yeah, if there's a significant weight loss or a significant weight gain, like that's like a really big alarm. And like even the state is going to look at that, like when they come to survey you, because it's like really important that we make sure that the weight stays within a certain range. So like there's just, it's clearly like an indicator that something else is going on, which is again, how our bodies, keep score or hold on to things. It could be by losing weight, it could be by gaining weight. And that's like, just like normal, just like part of life.
Yeah. It's actually really interesting that you gave that example of the person who was in the car accident and that correlated with the weight gain, because I think that that's very, very liberating, because a lot of times we think like this is my struggle and this is my fault and I'm stuck in this struggle and something's wrong with me. And really so much of it is even just out of our conscious awareness of my body's experiencing trauma and this is how my body responds to that.
Right.
Yeah.
I know I think that's one of the most liberating things about intuitive eating is that diet culture tells you like if you just tried hard enough you could be a size 2, like if you just cared enough, like if you just like controlled yourself enough. And it's like how did we get that far, like I really don't like to bring a lot of negativity about diet culture. That's not like my thing, but it's just like I think it's just highlighting like the extreme of it, like where it has taken us, that like we believe like Nebuch, this lady who got into a car accident, and like okay, that's how her body responded, weight gain, like so maybe you needed a little extra weight to help you get through it, like maybe you needed some cushion. And I have seen that. Before. And it's like, there's so much shame around it, or there's so much blame around it. And it's like, it doesn't necessarily mean that it's like really a bad thing. So I just really want people to hear that actually, because like there's a genetic component, there's a trauma component, there's a medication component, there is natural fluctuations, and like it's okay. Like I really want people to have that freedom.
Yeah, I love that. There's also the COVID component too. People talk about
Yeah.
COVID weight gain also,
Right.
and that's absolutely, I mean, whatever somebody needed at that point to get through the and COVID itself is a trauma that we're all still going through.
Right.
So, yeah, that's
right.
such an important message.
Right. Actually, I remember also, if you read Health at Every Size by Lindo Bacon, she or he, I'm not sure how to say it, but said that that like when she was writing the book, that she realized that she gained weight, and it was just like natural because she was so stressed out and like she had so much on her plate. So like I just think about that a lot in my own life. Like actually, I'll give an example that like I've spoken about this many times on the podcast, but when my mother passed away like a few years ago, I remember saying to my husband, like, it was like, but there's buy one, get one free ice cream here. in Woodmere on Tuesdays and Saturday nights. And I was like, can you just get me some ice cream? And I was like, I'm not hungry, but I really need that right now. And like, I remember thinking like, if the worst thing that happens to me is that I gain some weight from my grief, like, who cares? Like, just like it's such a powerful message, because like sometimes you'll gain weight and sometimes you lose weight. And so many people might be listening to this and be like, how could you be okay with that? Like the weight gain, it's like the worst possible thing in the whole world. And it's like, no, it's really not. It's really not.
Yeah. Yeah. And you're right. I mean, it is a really, really, really difficult message because it's been ingrained in us from the time we're little. I mean, I hope that we together can work to help change those messages. And we
Yeah.
are,
Right.
but it's been ingrained in us from the time we were really small, everywhere. Like, even if it didn't come from our parents, then it came from our friends. And if it didn't come
Right.
from our friends, it came from whatever, from social media. It's everywhere, these messages of just gaining weight is bad.
Right. So I will say that that's like my life's mission, like, and I think there is a shift. It's slow and it's not like where it needs to be, but I do think that even just this podcast, or anyone in our community who's willing to talk about it, Rachel Tuckman, or there's so many people out there that are advocating, really advocating. And I say that to clients sometimes, like when we talk about the principles of intuitive eating, I just said this last night, like reject the diet mentality is principle number one, but like you will be working on this the entire time. And I'm still working on this. And like, hopefully you'll become an advocate, because we need more voices, and just so that everybody knows that this is like supposed to be, this is a positive podcast. Like there is definitely change being made, and people are, schools reach out to me sometimes, and people really do want to spread this message. It's a little bit like it's we need more, because it's scary the way that I hear this all the time, like teenagers, sixth graders, seventh graders already talking about it. My daughter's 8. I already see some things that she's picking up. But I will say, on a positive note, for parents who are listening to this, the strongest message that your kids get are the message in the home. So like for example, if a mother will say like, I'm so scared that my child's in a larger body, she's going to get bullied. I say, like, if she feels unconditional love from you, she's going to be in much better shape than like you being like, not to blame anyone, but like if she could feel loved and accepted at any size, then she's going to have a really strong, positive feeling about herself. And if people bully her, okay, everybody, kids bully for lots of different things.
Absolutely. Yeah, absolutely. I agree with that so much. And I think as parents, it's really hard also because we get so many messages, even from like the pediatrician, well, your child is too large, put your child on a diet, or messages from like, well, my child's not fitting into this size. There's just so many messages out there as parents. And as parents, we're so sensitive to how are people perceiving our children and how are we, and yeah, it's very, very difficult.
Right. It's true. It's true. So I would say like the prevention piece is really important. Like doing your own research, fortifying yourself with these messages. Cause like, even I've had that at the pediatrician. I'm like, really? My child's 2. Like, are you really talking about this? And like, I want to be respectful, and I'm not like doctor bashing at all. I think doctors are really smart and helpful, but like, I do think it's important for us to educate ourselves as well.
Absolutely. And just another piece of that, it's like you and I are, and all those of us who are coming from the background have a little bit more, ability to say, okay, this doesn't make sense to me. But some people who may in the back of their heads think it doesn't make sense to me don't have the capacity for that. And so to say like, no, I don't agree with that, or I don't believe that. And so it's really important that we keep putting these messages out there, that we can give this validation to the people that may say, hey, I'm not sure that I agree with this.
Mm-hmm.
I don't know if I could stand up to this, or I don't know if I could say, say, no, my child doesn't need a diet. So
Right. I will say on that note, like just from somebody who has worked in the medical profession, just because I worked in the nursing homes for 5 years, like it was very well known. Like when we would actually, anyone who is admitted to a nursing home has to have a care plan meeting upon admission, and every 3 months, just for the history of nursing homes. So it was always very well known. Like if a resident has a family advocating for them, like asking questions, are you sure? But what about this doctor? Calling second opinion, they got better care. Mm-hmm. So like I saw that firsthand, so I could say that. And I know some people don't know what I'm talking about because they've never worked in a medical profession. But if your doctor is defensive because you're asking a question or you did some research, like maybe you need a new doctor, because not to doctor bash, but like doctors don't know everything. you are the expert of yourself and your child. And like, it's important that you advocate for yourself. Really important.
Yeah, absolutely. Absolutely. And to be able to do that, we need voices like this, and we need knowledge and understanding and people to talk about these things. And, it's really, you talked about the shift that's happening in the world in terms of very slowly, and I see it too, moving towards that. And it really, as therapists and amongst my colleagues, I see that shift happening too. Even 10 years ago, 5 years ago, there wasn't as much. It was like, here, client is struggling with their weight, so let me help them with that. And now there's a lot more discussion, on discussion boards and at meetings about how do we support a client through being okay with their body. And so it's really, the shift really has happened in this field too. And sometimes it can get like really tricky and really difficult, because especially when, if we are coming with our own messages and we haven't maybe fully, integrated these ideas of intuitive eating and health at every size, really, it could be a really big dilemma when clients come in with those struggles. And so it's really, even the field of mental health is moving towards the understanding of how important this really is. It's slow, yeah, but it's moving there.
That's really good to hear. I mean, I see that like, there's like, it's so funny because like in my own life also, like, this is a struggle, but like, what is like, what's the thing that like has struck a chord for me most, and like I try to relate to my clients, is that like going to therapy, having a therapist, she's not fixing you. She's helping you, like, in a lot of ways, accept the pain in your life. And like, sometimes I have to say that to clients, like, I can't change your body size. That's not my goal. And you might not be able to change your body size. And that, like, hopefully won't be your goal. So it's like, how do we accept this? Like, there's not always like something to do. I think that that's why dieting is so alluring, because it's like, well, I hate my life. I hate the way I look. I hate the way I feel. I hate this. I'll just diet. And like, that won't fix your problems. Like, sometimes we just have to accept our problems, which is really hard.
Absolutely, for sure. And you talked about that piece of control, and that's so huge, to be able to say, here's something in my life that I can control. That's such a fundamental piece of what keeps, people wanting to diet. And of course, I mean, especially when, life feels so out of control, or here's like something that, yes, I can change, but then it starts to become problematic when it gets more difficult to change that and all of that.
Right.
Yeah.
Yeah. Just like, for people listening who want to understand that, like, the biology is that like your first diet might be very easy. The weight might come right off, but that's because your body's not used to dieting yet. And once it gets, that's why so many people say, like, after like 10 years of dieting, I'm not even losing weight on the diet, right? Because your body's really smart and it wants to stay at a certain weight.
Yeah, absolutely. And that's such a fundamental piece. And it was a fundamental piece for me in understanding myself and my journey of like, my body's going to do what it needs to do. And if I can give it what it needs, then it will just be helped to do what it needs to do. And if I don't give it what it needs, then it's just going to not be able to figure out what's going on and try to protect itself. And, so, and all of that comes with that.
Right. That's what happens with dieting, like excessive
Absolutely.
dieting. It's just like, it's actually interesting. Like, the more we diet, the more like we prime our bodies to change our set point weight to get higher and higher. So like, the thing, even though it's like hard to believe that, it's just like, look at people who have dieted for so many years, like they've just continued to gain weight. So like, not that weight gain is bad, but like, if that's really your goal, like, dieting is not the answer. So
Yeah.
like, but I'm like feeling right now for the people who believe that dieting is going to help them, because I really do believe that for most people, it's not like, they really just lack the knowledge. Like, they go into the diet so hopeful, and like, it's so sad because they think they're doing such a good thing for themselves. Like, I hear so many people being congratulated for weight loss, and I'm not the type of person to like go and burst their bubble, but it's just like, it's like, look what happened. Like, you get so invested in the diet, and then you cheat, and you feel so negative about yourself, and then like you do it again. It's like so sad.
Absolutely. And there's so much, shame associated with that also, of like, there's something wrong with me that I can't keep to this. And it's so painful to see that experience. And there is something like you said, so alluring about the dieting, because here's something that I can control and something that I can change. And then it's like, that can only go so far. Like, I really don't have this sense of control.
Right. And it's so praised also. It's like so
Yeah,
praiseworthy in our,
absolutely.
so it makes sense that you would want to do it. Like, you would want
Yeah.
to get that external validation.
Yeah. Yeah. And there's so much camaraderie in that also.
Right. Yes, there's like that bonding, woman bonding, even male bonding now. Like,
Yeah.
what diet are you on? What are you trying? How much weight did you lose? Like, it's just like, I understand it, but it's just like, in a way, it's very sad. Like, how else can we bond as women? Like, do we have to bond over like body bashing? Like, is that what I like? That's what I often say to clients. Like, that might be like really important to you, but like, is that what you want to be really important to you? Like, if you could really choose what's important to you, like, do you want that to stay important to you? You know?
Yeah, absolutely. My mind is on something that you said before. Can I just go back to that for a
Yeah,
second?
go for it.
And everything you're saying is like so profoundly important. And it just struck a chord with me though when you talked about and I'm trying to just jog my memory back when you talked about people coming in and saying, okay, this is how I want to be fixed, right? And like you see that in your work, and that's actually a really big piece of what drew me to trauma work, because I always knew like I wasn't, I don't have the answers. I don't know how to fix people. The only person who can actually make any change in their lives is a person themselves. And so trauma work is such a gentle and really deep approach of just understanding and learning and accepting ourselves. And so it's really so much not about fixing. And when we're in a very difficult place, like oftentimes when we're coming into therapy, it's like, I just want this to change. And it's very difficult to say, okay, well, it's really just about the process of, learning who I am and how this came, and what can help me be strong and secure and grounded in my life. And it's really, that's also how my, work as a therapist has shifted as well away from that. And it definitely correlates again with that like control of dieting versus like, I'm just letting go and I'm saying, okay, I can just accept whatever, however change is going to happen.
Yeah. Actually, when you said that, I also like it like struck a chord, because it reminded me, actually, a lot of like sad things happened in my community over the last few days, and it's been like really, really challenging. And I actually remember speaking with my therapist in the beginning after my mom died, like thinking like, is she gonna bring my mom back? Like like these like crazy thoughts, like, is this even gonna help me? Because like I'm so depressed, And I don't know why I thought of this, but did you read the book Maybe You Should Talk to Someone by Lori Gottlieb?
I did read that book. Yes.
Yeah,
Yes.
so I don't want to give this away, but there's a part where she's talking to like a cancer patient, right? Her client's a cancer patient, and the cancer is not getting. She's a young woman. She was newly married. She's not getting better. It doesn't seem like she's getting better. And I remember I think either of the clients said like, I just want to say the F word. And Lori's like, just say it. And she said that they started screaming the F word back and forth to each other. And she said, like, the people in the waiting room must have thought they were crazy. But like, that was a very profound scene in the book, because it was like, she just screamed her feelings out and didn't change the outcome.
Yeah.
But she had someone there to do that with her. And like, I know this is like so extreme, and I don't even know why I thought of it, but it's like, that's how I'm feeling now, like, not that I'm going to curse, but like, sometimes like life really is that painful, and like, yes, time heals sometimes, and like, but just having that support, having the somebody who has experience with trauma, has seen it before, knows that the person can move forward, it's like that in and of itself is super healing.
Yeah, absolutely. Absolutely. And it's also so fundamental for ourselves as human beings to be able to say like, I'm not okay right now. And that's okay. I can be okay with not being okay. And I think that that's really like, that's how I kind of understand trauma work. Like, yes, one day maybe we'll say, okay, I've worked through this trauma enough that it's not so strong anymore, but it's always a part of who I am. And I can still be okay in those moments when the trauma is really strong. Like it's okay. It's okay for me to, my body is safe in this moment. And I can, I can feel like the world is just crumbling around me, and I cannot feel okay for a long time.
Right.
And that's okay.
Right. Like if somebody has like a reaction physically because something triggers the trauma, to know that like that's normal and that might happen, and like you might feel like you're going to die, but you won't. And like just somebody saying that to you, somebody holding that space for you, it's like, it's just so powerful. It's like so important.
Yeah, absolutely. And that comes back to the theme, because at the same time, it's like, yes, I can be in this place of feeling that I'm going to die for whatever amount of time I need to be in that place. And it's kind of like the antithetical to the need to control. It's like I'm giving up all that control, and that goes with dieting, and that goes with all of mental health and everything that we struggle with.
Right. And something else that you just said also was so interesting that you said, the trauma never leaves you, right? Even if you learn to live with it. And it's like the was for so many people, dieting or being a certain weight is their identity. So it's like getting rid of that is like really like, I don't know if you'll ever get rid of that, but you could change your identity. But if it's like just knowing that it's been a part of your identity for so long, you're somebody who diets, you're somebody who controls themselves, you're somebody who stays a certain size. That's like really hard to change if it's like who you feel like it's your identity.
Yeah, absolutely. I like to think of trauma as like a roadmap. It's like we've driven across like certain lines in our body, and it's like etched in there. Like the trauma
Mhm.
is etched in our bodies, and so
Mhm.
we can work through that, and we can make it that it feel less strong, but it's always there, and it's always etched in who we are and how we're going to relate to the world. And the same thing with dieting, that's etched in there too. It's
Yes.
just part of the essence of who we are, and so we can
Yeah.
learn ways to live with that, and to make it not as strong, and to find things that are important to us, and places that do bring us joy. And
Mhm.
at the same time, it's still part of who we are. One
Yes.
doesn't negate the other. Yeah.
Right. Like I have so many clients that are like, when am I going to stop like looking at the nutrition facts? When am I going to stop comparing my body to that person's body? And I tell them like, I still do that. That's still hard for me. Sometimes I look in the mirror and think like, I wish this part of my body was smaller. That doesn't make me a hypocrite. It's part of me. I work very hard against it. It's not part of the value system that I want, but that doesn't mean that it's not hard.
Yeah, absolutely.
Well, anyways, this was amazing. And I like to tell people that like I really enjoy the organic conversation. Like some people want me to send them questions before, but I prefer the organic conversation. You never know where it's going to go. So this was amazing. Do you want to leave the listeners with anything else?
Sure. Well, I'll leave you with something first also, though. First of all, I think everything you shared was so important, and such important messages to get out to the world. And I think you're doing amazing work. And the fact that there can be such a strong voice just saying, hey, I don't care what the rest of the world is saying. I'm saying what I believe and what I know is true. Yeah. And then just for everyone listening to this, there's so much shame associated with all the things we carry when we have depression, anxiety, body struggles. I mean, everything
Mhm.
that we struggle with has shame associated with it.
Mhm.
And sometimes it's just like when we can say, okay, other people have these struggles too, or there are places we can bring these struggles, and it doesn't mean that there's something wrong with me. And that's so much of working with trauma. And again, when I say trauma, it doesn't have to be something big and huge. It just means the real intense struggles that we've been through in our lives. And when we can say, okay, this is what's causing me to have this experience, or to behave this way, or to engage in this behavior, it's just so freeing to allow ourselves to understand that there are things that are happening that are sometimes even beyond our control. So
Yes,
yeah.
that's so important for people to know.
Yeah,
I really hope that this interview specifically is giving people the tools to know that we don't have all the control that we think, and like the acceptance piece is really important, and finding the support system that you need. And like, yeah, sometimes we're the only ones, like we're swimming upstream, but like we could listen to our intuition and know what's right for us.
absolutely. That's like the biggest piece. That's that's how I like to say it, that I guide my life, like my intuition. And intuitive eating has taught me that so much, so much. And that's what trauma therapy teaches too. What is my intuition, and how do I
Mm,
access that? Yeah.
yeah, I love that. I really should take that trauma training.
Yeah.
uh
Fantastic.
yeah.
Yeah.
Okay, do you want to I'll put all your information in the show notes, but do you want to share that here just so people could, if they want to reach out to you?
Yeah, sure. Okay. So again, I have a private practice in Cleveland, Ohio. My phone number is 216-309-1766. And that's really the best way to reach me. You can email Shifra at healinghappenscle.com. And I will respond to emails or phone calls or texting.
Okay, great.
Yeah.
Okay, great. So I'll put all that in the show notes. Thank you so much for joining me.
Okay.
This was great.
Thank you, Gila.
No
Okay.
problem. Have a great day.
Okay, you too. Bye-bye.
Okay, bye.